Kia ora. Welcome to the Ubuntu 2024 podcast. I'm your host, Dr. Joe Scott Jones, a rural GP in New Zealand. The word Ubuntu comes from the Zulu and Xhosa languages and can be roughly translated as humanity towards others, the belief in a universal bond of sharing that connects all humanity. I am because you are. Ubuntu 2024 is an in-person and online conference jointly held by the Network Towards Unity for Health and Rural WONCA, the World Organization of Family Doctors Working Party on Rural Practice. Ubuntu 2024 will be the 45th anniversary of the Network Towards Unity for Health and bring the TUFH annual conference together with the 20th WONCA World Rural Health Conference. Ubuntu 2024 is hosted by 5 partners: University of Western Cape, University of Cape Town, Stellenbosch University, Peninsula University of Technology, and the Western Cape Government Department of Health and Wellness. In September, Cape Town, South Africa, we will see Ubuntu 2024 bring together health professionals, educators, thought leaders from across the globe to explore the theme of people, place, and policy for community wellness. And today I'm talking to Dr. Ian Couper, a director at Ukwanda Centre for Rural Health, professor of rural health in the Department of Global Health, Faculty of Medicine and Health Sciences at Stellenbosch University, one of the partners hosting Ubuntu 2024. Ian and I go back a little way. He has got particular interests in medical education and human resources for rural health, and in 2021 was elected as a member of the Academy of Sciences for South Africa. Did I get all of that right, Ian?
Yeah, it sounds right. Thanks, Joe. It's good to be with you.
Tell us a little bit more about yourself.
So I'm a rural doctor, family physician by training. I went into rural practice around 1991, in fact, and I was 25 years in the public health service in South Africa, working in rural areas. During that process, I got involved in academic work as well, and there was a particular juncture in my life where I needed to sort of decide, am I going to go into more in health service management or more into education alongside the clinical, and I went in the more academic direction. Yeah, so that's, and it's been a development since then. Before I was at Stellenbosch, I spent 14 years at Wits University in Johannesburg and working in the Northwest Province, and joined Stellenbosch University in 2016.
And what was it that led you into medicine in the first place? Why did you choose medicine?
Yeah, so my father was an anaesthetist, and I actually thought I would not do medicine because of that. And I actually went and did a BA and was going to do psychology, but I really felt that I wanted to make a difference to the poor and the oppressed in South Africa. This was in the heyday of apartheid in South Africa, and I felt that as a strong calling, and it just didn't seem that there were avenues at that time in psychology to make that kind of difference. And I decided that I was going to tackle medicine. I didn't have any idea about rural at that stage, but actually, I mean, that's that same drive that led to me to rural, because at that stage, if you really wanted to make a difference in that way, a rural area was the most obvious place to make a difference. And to this day, I mean, social justice, equity, and things like that are very strong motivators for me.
Yeah. You're reminding me of my. I have 5 children, none of whom have chosen medicine as a career.
None of my 3 neither. So join the club.
We have done our jobs wonderfully well there, have we? So tell us about Stellenbosch University and also your role with Rural WONCA, and how those bring people together and advance the health and well-being for people. Why and why we should maybe come to Ubuntu in 2024.
Okay, a lot of questions at once. So
I'm sorry.
No problem, but maybe I'll start with Rural WONCA because that predates it. So I actually had the privilege of attending the first international conference on rural medicine, as it was then called, which was in Shanghai in 1996. And I met a whole lot of the people that I still see today going to rural conferences. I've been to every single World Rural Health Conference since then. I keep on saying this is going to be my last. Well, maybe Cape Town next year will be my last. But it's become a real community. But it was, it was an unusual experience because a few of us were sponsored by the Department of Health in the province of KwaZulu-Natal. We were working at the time to go to this conference. I mean, it's very unusual for doctors to be sponsored by the Department of Health to go to a conference, and we were able to go and join that. And then subsequently, we hosted the second World Rural Health Conference, and we changed the name to Rural Health Conference, and it's been Rural Health ever since. But yeah, so that connection and a lot of my things that I've been fortunate to be part of in my life academically and otherwise have come through that involvement with Rural WONCA. And really the focus of Rural WONCA has been about making a difference for rural communities, has been about access for rural communities, has been about supporting rural health. So we established the Rural Doctors Association in South Africa in 1996, initially under another name, but then at the time of the World Rural Health Conference became the Rural Doctors Association of Southern Africa, RUDASA. And we started campaigning for academic positions for rural health in South Africa. There were none at the time. And I subsequently was the Wits University established this position of in rural health, and I was invited to apply, and I did, and that's where I really started my academic career took off. That was in 2002. I was appointed a professor of rural health at Wits, which was quite unusual coming kind of from outside of academia and being appointed at level, but it was part of them wanting to have an impact and working in the Northwest province and establishing rural training. But in fact, that wasn't the first centre for rural health in South Africa. The first centre, I mean, I established a centre subsequently. The first centre was actually Stellenbosch University. They planned in 2001 and 2002, the Stellenbosch University Ukwanda Centre for Rural Health was established. So they were talking about that already at that time, and it was slightly ahead of it, and was very much about saying we want students across all health science programs to be exposed to those things that we've been talking about so often. They were there doing it first. And I actually gave input at the time, and it was involved a number of times in different ways, doing consultancy, sort of informal work in a sense, for Stellenbosch University. I never ever thought I'd land up there, actually in the position I am. But I was ready to move from Wits in 2016, and this position came up and was advertised for the first full-time director of Ukwanda. Had been part-time directors before then. And yeah, I took it, and it's been great, and it's really something that's acknowledged in the university. There's support for it. It's growing. We're developing postgraduate programs. We've extended our undergraduate programs. We've got a developing research program, etc. So to be part of that, and one of the things that's been exciting about being part of that is how we have an influence on what's happening in the so-called main program, in the medical school, that we try things out and then we bring them into the medical school. Increasingly, how students have more and more interest off at the background is we have a beautiful campus that was built in Worcester, which is a regional town an hour and a half outside of Cape Town. If you come to Ubuntu 2024, the community site visits, some of them will take place in Worcester. You'll be able to see it. But there was very fortunate funding that came through and was able to build this lovely place where we've got accommodation for students, and it's a beautiful site. We took a leaf out of the Australian book, and we made sure that we did rural training in wine growing areas.
That was the only thing I knew about Stellenbosch beforehand.
But yeah, I mean, it's lovely to be part of that. And interprofessional education is very much part of what we do, and we focus on interprofessional collaboration in terms of the actual practice. So that links very nicely with the network towards Unity for Health, for bringing different backgrounds, disciplines, perspectives together. Yeah, and I've been to a number of TUFH conferences over the years as well. So in a sense, that I feel like I'm also bringing the two together.
You
As
embody
we prepare
Ubuntu.
for Cape Town.
Yeah. The
I don't know if I covered all of your questions in that.
Oh no, that's fantastic. So the it resonates quite a lot. I mean, that the inspiration that you get from and connection and collaboration that arises from involvement with international colleagues through Rural WONCA really supports us in our work in our own communities, building up services and education around rural health. You know, we learn so much from that international collaboration, and I know that it's been one of the focuses for Rural WONCA to try and help communities that don't have family medicine programs, that don't have rural family medicine programs, training programs, to really try and reach out into those communities to try and sow the seeds of starting that, which is you know, it's a fantastic thing to be part of, even in the, you know, the for me, tiny little ways, but for, you know, for people like yourself with their expertise, you know, it's a fantastic thing that you do. Tell us, apart from drinking wine at Stellenbosch University and when we come to visit, why else should people come to Ubuntu 2024?
Well, I mean, yeah, I mean, Cape Town, it is, I mean, it's been rated as one of the top cities in the world. So, I mean, I could spend a lot of time on the location. I mean, and as I say, I never thought I'd land up at Stellenbosch. I never thought I'd live in Cape Town, but it's been, I've lived all my working career, except for the first 2 or 3 years, I've lived all my working career in rural towns, and now to be living in Cape Town, and but actually what it has to offer is so much in terms of the natural environment and outdoors and things like that. So in some ways, it's an overgrown village. But yeah, but in terms of the conference itself, I think it's, as I've alluded to, I think it's really exciting that we are working together as 4 universities in Cape Town. I mean, always there's these, you know, the friendly rivalry, and sometimes not so friendly rivalry between the universities. But yeah, to be working together on that is exciting. To be working together with our Department of Health and Wellness, and that's one of the things, we're the only province who has a Department of Health and Wellness, and they take that very seriously in terms of the way that they function. But also to be here, to be bringing the network towards Unity for Health and Rural WONCA together is exciting. So one will both benefit from people who are very involved in the area of community-based education, socially accountable education, interprofessional education, etc. But then also people who have very strong roots in terms of rural practice and clinical practice and education and research. And there's a lot of overlap and a lot that we can learn from each other and that we will share with each other. So I think it's going to be a great conference with lots to learn.
Yeah.
I do want to add that we're also organizing a rural post-conference tour that will be available for people to do afterwards. We're going to but we're doing that between University of Cape Town and us at Stellenbosch. We're joining together to offer that, and you'll visit some training sites of Stellenbosch, rural training sites, and then some rural training sites of University of Cape Town, with some nice tourist things as well mixed in with that.
Fantastic. Those post-conference visits are really impactful, to, you know, get a bit of a deeper dive into the system and the people and the place, which is so important and a key theme for the conference. So thanks, Ian. Thanks, absolutely fantastic talking to you. To find out more about Ubuntu 2024, visit the website ubuntu2024.com, and we hope to see you all there.